Have you ever sat around and thought about what it would be like to not be able to use your arms for 3 months? Not to be able to do things for yourself the way you used to? Neither have I, until I started working at the hospital in Gastonia. Because I work on a floor, it's called CVSU, it stands for the Cardiovascular Surgery Unit. And there we deal with CABG patients, which is a coronary artery bypass graft. And according to the Mayo Clinic, the precise definition for coronary artery bypass graft is when you take a vein from a person's leg and use it in the heart arteries to help reroute the blood flow to the person's body. This is used when a person has had a heart attack or they have really bad blood flow, or their EF, which is their ejection fracture, which is how well their heart pumps, just isn't the greatest. They could have an EF of like 15, which means that their heart is pumping super slow and they're not getting enough blood to their organs and to the rest of their extremities in their body. And having a CABG helps reroute the blood and helps your heart beat stronger, and your EF in turn would sometimes it'll get higher, sometimes it stays the same, and it just prevents it from going any lower and you eventually having another heart attack or dying from heart problems. Most people that have bypass surgery, they are hooked up to an ECMO machine during their heart surgery. They have to be, because something has to keep their oxygen flowing. An ECMO machine is just, it is similar to a heart-lung bypass, but it's different. It pumps oxygenated blood to a patient's body, and it allows their heart and lungs to it allows their lungs to keep beating, so that they can have surgery performed on their heart while still being able to breathe. And that definition is according to hopkinsmedicine.org. After heart surgery, most people will have to be in the hospital for at least 5 days. They like for you to walk at least 3 times a day in the hospital. This is just according to my hospital. This isn't like any set rule. Depending on the hospital that you go to, really depends on their set rules after your surgery. We like to have patients up to the chair every day, 3 times a day for meals, breakfast, lunch, and dinner. They need to walk in the hallways at least 3 times a day. Everybody is on sternal precautions, which is where you can't push, pull, or tug with your arms, because you have, they just had their chest popped open, so they have a scar from about here to right above their navel most of the time. And it's closed up with staples. And then they have a chest tube, which is a tube that's about as big around as a ruler, and it's circular, and it goes into your lung cavity to help drain excess fluid out of your chest cavity. Because whenever you have open heart surgery, your body fills up with excess fluid because you was just operated on, and it helps drain out the excess fluid that's in your body. And those are in typically for about 3 days, depending on how much the person's up and moving and how much they walk. Walking increases the how much the chest tube dumps, and we say dumps because it dumps out the excess fluid into what we call an atrium, which is just a little box that's attached to the end of the chest tube. And after the cardiovascular surgeon sees that it has dumped as much as he wants it to, they will pull the chest tubes out at bedside, and they will do a chest x-ray to make sure that there's no pneumothorax in the lung, which is just a pocket of air that's in the lung cavity or in the chest cavity, to make sure that they don't need a repeat chest tube. So they do a x-ray, and once everything works out fine, if they've been up and walking and have been up to the bathroom and been up to the chair for meals, and as long as everything is working good, they're going to let them go home. But after they go home, they still have to follow certain rules. They have to hug a heart pillow for at least a month. They can't drive a car for 3 months. They can't ride a motorcycle for 3 months. No horseback riding. No very strenuous activities for at least 3 months. Even after you go home, you have to still wait for your 1 month follow up with your cardiologist before he'll give you any further instructions. And with a CABG, it's very, very easy to get your wound infected. I've been there 2.5 years, and I've seen at least four people have to come back for repeat surgeries because their wounds have got infected, or they've got home and they've popped it open, or they popped it open at bedside and they had to be rushed back to the OR pouring blood. So please, 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 I urge you to take care of yourself, because if you don't, being in a situation like this is not very great. So just please take care of yourself. Thank you.